Mic muted. Okay, good morning, everyone. Welcome to the program Agenda. I'm your host, Cito Beltran, and today is a Thursday, if I'm not mistaken. Yeah, it's a Thursday, and August 26, 2021. Thank you for continuing to join us in the program, watching us via Cignal TV channels 8 and 250. And you can, of course, watch us on Facebook.com. But being on Cignal seems to be a lot more reliable nowadays. Ewan ko kung naglalabo-labo sa Facebook. But sometimes the viewers claim that sometimes there are problems. But anyway, welcome once again. And let's go straight to the front page of the Philippine Star because we have a lot to discuss today. And there you go. On the front page, the headline is No Rodi VP bid if Sara runs for president. Madaling salita, hindi tatakbong para sa ikalawang Pangulo or Vice President si President Rodrigo Duterte if his daughter Mayor Sara Duterte runs for president. In response, Sara to Rodi and Bongo, stop using me. Huwag daw siyang gamitin sa kanilang pamumulitika. At the top of the paper, COVID cases may hit 2 million in a week. Now, we will explain that later. Let's go to the bottom of the front page of the Philippine Star, and you will see there that the COVID-19 cases as of yesterday shot up to 13,573. Okay? And then the number of deaths, 228. 228 po namatay kahapon. Meantime, the PDP Laban Coco Pimentel faction says that Manny Pacquiao is still their bet for president. And then the Philippines hits coercive use of militias, Coast Guard in South China Sea. Rodi says he will accept Duque's voluntary resignation. Ha ha ha! Ay nako, voluntary. Nagbigay ng resignation, hindi tinanggap eh. Okay, DILG extends ayuda distribution. Headline, and yung pong picture na yan na nakikita ninyo, yung dalawang picture. The one is Isko Moreno leaving the hospital, being cleared, but he still has to go into home quarantine, I think, for 3 days. And then on the bottom, you have health workers staging a noise barrage at the Jose Reyes Memorial Medical Center in Manila, release meals, accommodation, and transportation benefits. Now, let's go to the stories behind the headlines. President Rodrigo Duterte will drop his vice presidential bid if his daughter, Davao City Mayor Sara Duterte, decides to run for president. The palace confirmed, adding that Duterte and Senator Bongo will not run for national positions because of delicadeza. conditional delicadeza. At least in fairness to Bongo, I heard a statement of his on DZRH where he was saying, bakuna muna bago politika. He was saying he would rather focus on the health concerns as chairman of the Senate Committee on Health. Okay. In response to the statement of President Duterte, Mayor Sara Duterte told his father to stop using her as a pivot for his political plans. Ewan po, hindi po natin alam kung sarsuela yan, but, or it is really, an issue. But anyway, meanwhile, the country's total COVID-19 cases may breach the 2 million benchmark next week. Okay, nililinaw po natin, total number of COVID cases, hindi po yan daily case. Sinasabi po, total number of cases, okay, will hit 2 million by next week. Okay, Octa Research Fellow Guido David noted the country had a daily average of 15 8,228 new cases and 267 deaths from August 19 to 25. As of yesterday, the Philippines has recorded a total of 1.83 million cases with over 125,000 active cases, while 228 new deaths were tallied yesterday. Okay, and the final piece, President Duterte continues to defend Health Secretary Francisco Duque from pressures of firing him over various issues. However, if Secretary Duque himself offers his resignation, he would accept it. Okay? Duterte previously disclosed that he rejected Duque's resignation twice. Okay? Yan po nakakataka. Very strange because at least twice the president said, "Wag kang mag-resign." Someone should have asked, "Pat, nagre-resign ka ba?" Pinggoy, nagre-resign ka ba? Ngayon, iba na yung bitaw eh. Kung mag-resign siya, di pagre-resignin ko siya. Hindi nga nagre-resign eh. Okay, the quote of the day comes from the book of Luke, from the Bible, chapter 12, verse 16. Pakinggan po ninyo ito ng maigi, lalo na yung mga negosyante, mga marami ang kinikita. Okay, let's start. Okay, and he told them the parable. The ground of a certain rich man yielded an abundant harvest. He thought to himself, "What shall I do? I have no place to store my crops." Okay? Ang ganda ng ani, sobrang dami ng inani, hindi malaman kung saan ilalagay yung inani o yung pera. Then he said, "This is what I'll do. I will tear down my barns and build bigger ones, and there I will store my surplus grain, and I'll say to myself, you have plenty of grain laid up for many years. Take life easy, eat, drink, and be merry." Ayan po, no? In our modern world, there are a lot of people who are into growth, expansion, etc. But God said to him, "You fool, this very night your life will be demanded from you. Then who will get what you have prepared for yourself?" Okay. Why are we using that Bible? Okay, this is how it will be with whoever stores up things for themselves but is not rich towards God. Okay, kumbaga, inuna mo yung kumita ka ng kumita, you prioritize profit, income, wealth, power, position, etc. And you forgot to consult God, trust God, follow God, and then one day, God said, "Time out, kunin nyo na yan. Walang pakinabang yan eh. Puro pang sarili ang inasikaso." And I was led to share this Bible verse because a lot of people have been in that track or that mode before COVID-19 came, before 2020. Lahat tayo puro promotion, expansion, growth, etc., investment. Ngayon, tinamaan tayong lahat ng lintik. Mabuti, buhay pa yung karamihan sa atin. I think it is about time that many of us think, stop thinking in terms of saving, storing, and growing. Start thinking in terms of praying, reading the Bible, and praising God. Okay, now, let's go down to reality naman. Ito, if you've been listening to the news, one of our favorite congresswoman participated in the congressional investigation of Philhealth regarding yung mga unpaid claims of hospitals. Doon natin nalaman. Kasi in 2020, Philhealth said, malamang at malamang we will have financial problems because of COVID-19, low income, high demand, etc. Nung inimbestiga ni Congresswoman Stella Quimbo, Marikina 2nd District Representative and Deputy Minority Leader Stella Quimbo, nalaman niya Teka, sabi niyo malulugi kayo eh. Kumita pa kayo. Okay, let's bring in Congresswoman Stella Quimbo. Ma'am, good morning.
Good morning, Cito, and good morning to all your viewers this
Yeah,
morning.
you know, I was really happy that you were in that congressional hearing because if you had not been there, we would not have learned na ito palang PhilHealth, daing ng daing na mauubusan sila ng pera, baka mabangkarote, and then you pointed out, buti na lang, economist ka at magaling ka sa mathematics, hindi ka tulad ko. Ano ba talaga katotohanan? What is the real score with PhilHealth, Congresswoman?
Well, yun nga, no, Cito, last year, they were warning us that they would be in deficit. They would incur an 86 billion peso loss last year. But as it turns out, they made 30 billion pesos. Diba? So, ayoko nang tanungin kung bakit they were trying to raise alarm bells, but in the end, hindi pala, no? But at least bottom line is, hindi pa mamamatay ang PhilHealth as what they were warning us last year, di ba? Na sinasabi nila, baka mamatay na ang PhilHealth, etc. So buhay na buhay pa. And at the same time, makes us wonder bakit hindi pa nila binabayaran ang unpaid claims ng ating hospitals. And as we know, nagbabanta ang ating hospitals na mag-disengage from PhilHealth kung hindi sila bayaran. So meron na ngang pagbabanta ang ating frontliners na baka sila ay mag-mass walkout kung hindi mabayaran ang benefits nila. And then on top of that, meron pang pagbabanta ng pag-disengage ng hospital. So yan ang problema sa ngayon na Cito. So just for context. Yes.
So what happened during the congressional hearings? Because even after I interviewed a lot of the the Primary Hospital Association president and read the news this morning, it seems that the hospital associations, the various associations, are not happy. And if this continues, they will likely disengage with PhilHealth.
Well, actually, yung pinag-usapan, Cito, in the last hearing was the circular ordering the temporary suspension of claims. So, ang sinasabi nila, yung mga hospitals na merong fraudulent claims or suspected fraudulent claims ay hindi makakatanggap ng any form of claims. So, yun yung actually pinag-usapan dun sa hearing. Yung pong tungkol sa unpaid claims ng hospitals, iba pa. That's going to be heard this afternoon. So, yung lang circular ng temporary suspension ang napag-usapan. Ang niraise ko naman doon is, parang ang sinasabi nila, that is their way to prevent fraud. Pero ang tingin ko, sabi ko, hindi ba the better way to prevent fraud is to increase your capacity? Ibig sabihin, ilan bang abogado ninyo? Lumalabas parang napakakaunti, hindi ko na matandaan, parang isa o dalawa lamang ang abogado kada region. So if you only have 1 or 2 lawyers per region, how do you expect to be able to prosecute all your fraud cases? Which is why napakakaunti ng kanilang pinapanalunan na cases in court pagdating sa fraudulent claims. In which case, baka ka talaga malusutan, di ba, ng fraudulent claim. At sa tingin ko, suspending claims is not the way to address fraud. It's increasing capacity, yun na nga, in terms of legal. So also, at pag sinabing capacity, bilang ng tao, and at the same time, yung paggamit ng IT, paggamit ng modern technology to detect fraud.
Okay, now, Congresswoman, pasensya na, no? Ayoko kayong pangunahan, kayo yung Congresswoman, so kayo yung nasa hearing. Pero kung naupo ako doon, I think I would first be asking for myself, what is the basis of your claim for fraud? Kumbaga, nasabi ba nila or were they able to present you their data on the number of fraudulent cases that they've detected or have listed down? Kasi parang before you start coming out with a circular like that, you have to have a basis of actual attempts.
So meron silang mga general categories of fraud tulad ng upcasing. So ibig sabihin, as you know, no, ang bayad ng PhilHealth ay case rates. Ibig sabihin for every illness, merong kaakibat na amount na pwede mo lang maklaim. And these are like
package.
3,000 plus. Yes, yes.
Mm.
So one way is yung tinatawag na upcasing. Ibig sabihin, kunwari, mild pneumonia ka lang talaga, pero ang siningil ng hospital is for severe pneumonia. So ibig sabihin, nadadagdagan ang sinisingil. No? So that's one. And the other is yung ghost claims. Ibig sabihin, nag-claim ang hospital for let's say 100 patients, pero ang dumating lamang talaga at nagpa-treat ay let's say 40. So ibig sabihin may dagdag na 60 na ghost claims. So may ganun sila na general categories of fraudulent claims.
Yeah.
So pero hindi clear sa akin kung paano niyo ba na-determine. Hindi klaro. And they said that one way is may ginagamit sila na program, yung tinatawag na MIDAS. Pero yung the exact details, hindi maliwanag.
Ayun na nga kasi when I was interviewing the Dr. De Grano, one of the points that came up in our conversation is that this circular that was issued on circular number 13 issued on Friday the 13th was a prejudgment, very accusatory, and then it was an abuse of power kasi okay, may isang claim na fraudulent, i-hold mo na for 120 days, 100 or 1,000 claims. Did that come up in the hearing, Congresswoman?
Well, yung the exact details kasi alam niyo Sito ang isang limitation sa amin 'no, 5 minutes lang ang pag-i-interpolate ng bawat
Ilan po?
congressman.
Ilan po?
5 minutes lang. Yan ang so ang hirap to really get the more details 'no. So ang nakikita lang ng bawat congressman is yung talaga yung kumbaga the tip of the iceberg. Pero gano'n, lumalabas sa datos is there are only 4 cases or 4 hospitals ang napasuspend nila ang claims. Yan ang sinasabi nila. So ang sinasabi ng Philhealth, huwag kayong mag-alala. Pag sinasabi namin may temporary suspension of claims, historically, napakakaunti naman ng hospitals ang talagang sinuspend nila ang claims. Sabi nila 4 lang, which is less than 0.5% of all hospitals kasi 9,000 plus ang mga hospitals. So may sinasabi silang ganon. Diba? Pero ang problema nga, once masuspend ang payment mo, pwedeng malawakan. No? Pwedeng hindi lang yung particular claim na yon ang sususpendan ng claim, kundi all related claims daw. So ibig sabihin, kung pneumonia yung tila suspected fraudulent claim, maaaring lahat ng pneumonia, baka pati COVID, ay masama dito sa suspension. So may ganon. May mga gray area na sa totoo lang, it's in the devil would be in the details as to ano magiging total effect po niyan.
Ako'y nadidemonyo din matanong ko lang, sila ba ay may mga doktor na nagsuri ng mga claims na yon o puro accountant at abogado lang? Kasi, Congresswoman, and I'm sure you know this, the difference between yung pneumonia, severe pneumonia, and COVID-19 was such a thin line in 2020 besides the fact na nagkakagulo nga yung mga hospital, maraming nag-shutdown, nag-break pa yung mga health workers. Parang it's such a thin line na kung ang titingin ay accountant, patay na yung hospital dyan sigurado. Pero kung titingin na yung doktor, parang valid. Was that ever determined in the hearing who are analyzing those fraudulent claims?
Sana Sito, congressman ka na lang. Para kung napaka-relevant nung tanong na yon, no? Hindi namin naitanong yon. But base sa pagkakaalam ko, for you to be a claims officer, you don't need to be a doctor. No? So karamihan sa mga claims officers na nagpo-process ay hindi naman doktor. No? But they're trained to check the documents, kung complete ba siya, etc. Ang hindi ako sure is kung meron silang tinatawag na audit. Kasi the way to determine yung sinasabi ninyong possibility nga na mild ba yan or critical or severe is to really do the audit. Diba? Ibig sabihin, post-audit, dapat may sampling ka, kukuha ka ng let's say 5% of claims randomly drawn at i-check mo using a medical team. Wala pa ako naririnig na ganong klaseng procedure na ina-adopt ng Philhealth. Pero magandang recommendation yan. Baka pwede natin ma-recommend mamaya sa hearing.
Yes, ma'am. Please do so, no? Kasi I know of at least one claim, one case where the family of the patient were complaining against a hospital. Kasi sabi nung mga pasyente, nung pamilya, severe na yung tatay namin, severe COVID na yan. Dapat ilagay ninyo yan sa case na severe COVID, hindi pneumonia. Eh sabi nung hospital, hindi naman po kami babayaran dyan eh. Kahit ilagay namin dyan, if we will not be able to claim, they will still put it under severe pneumonia. So, and then it is also based on the test. The problem with the test is there is false negative, there is false positive. So anyway, ayoko na po ubusin oras nyo. Alam ko, were there any other, aside from your discovery that the Philhealth is far from losing money, what other significant discoveries were determined yesterday?
Well, para sa akin, meron kasing tinatawag na konsulta package ang PhilHealth. Okay? If you recall, the Universal Healthcare Law has two important objectives. One is to give PhilHealth coverage to every Filipino. That's one. And the other is that every Filipino must be registered to a primary care provider. Ang ibig sabihin, sa madaling salita, ang bawat Pilipino ay dapat may sariling doktor. Na ang ganda, di ba? And sa ngayon, napakakaunti ng mga Pilipino na may sariling doktor, believe it or not, no? So, yun yung konsulta package, no? So, and that's part of, for some reason, that's part of PhilHealth's program. Ang nakakalungkot, Cito, is that as of today, only 30,000 Filipinos are covered under that package. So, naging batas ang Universal Healthcare Law noong 2019. So, halos 2 years na, magti 3 years na, pero ganun pa lang ang progress in terms of primary care. So, that's only 0.027% of the entire population. Ang konti ng Pilipinong sakop ng konsulta package na, as we know, ito yung prevention di ba? Ang sabi nga nila, it's better to prevent, di ba? Kasi mas mura yun So, yun hindi natin alam kung bakit napakabagal. Ang sabi nila, sabi ko, paano nyo gagawin yan? Paano ninyo isi-scale up yan as soon as you can? Sabi naman nila, parang relax lang. Kaya pa daw. So, yan ang kailangan natin i-remind sa kanila na it's equally important. No? Hindi lang giving insurance coverage, but at the same time, making sure that may access ang bawat isa sa preventive care.
Well, your concern is very well placed because right now the infections are happening at home, within families, and it's no longer an issue of hospitals having the capacity. It is preventing the infections at home. Kasi noon ko pa naman talaga inaangal yan na magla-lockdown ka pero iikot naman yung isang miyembro ng pamilya and then iuwi yung COVID. And now we are paying for our sins, as the saying goes. Now, what are your plans in terms of legislative agenda to resolve this matter? Kasi mukhang ang daming mga kakulangan in terms of communication, ang PhilHealth and DOH. Yesterday, I found out for the first time na marami palang binibigay ng mga test kits, o bibigay pala ng libreng test kits ang DOH sa mga barangay. Ang daming mga tiga-barangay, punta doon sa mga laboratory, sa Red Cross, sa hospital. Doon pala sa barangay, meron palang free test kits, hindi nila alam.
Parang sa akin, Cito, it's a coordination problem. Ibig sabihin, like kung anong ginagawa ng PhilHealth, bakit hindi alam ng DOH? At the same time, itong konsulta package, which is preventive care, ang pinagtatakahan ko, bakit siya nasa PhilHealth? Dapat ang timon
DOH.
dyan is DOH. Kumbaga,
Or DILG.
kung ginagamit, pwede. Or DOH. LG kasi syempre paano mo si-scale up yan, gagamitin mo ang mga rural health units, etc. Diba? So parang ako yan ang nakita kong, yan ang first ko na parang takeaway, no, na kulang pa ng ganon. And sa tingin ko parang nasa leadership yun, nasa management ng buong kagawaran. Kasi the yung board of PhilHealth is led by the DOH secretary.
Yeah, and then every time we point out something that the secretary should move in, he always says, "Well, I'm only an ex officio chairman." So sabi ko, paano ba yan? Pag may problema, parang wala raw siyang karapatan. Pag walang problema,
Oh.
siya raw ay may karapatan. Ano ba yan?
Oo, kasi kahit na sabihin natin na ang resources ay marami dun sa resources for health are with PhilHealth. The end of the day, ang ultimate goal really is improved health for the entire population, di
Yeah,
ba?
but
So, dapat health secretary. Tama po.
sorry, Mama. Pursuing what you're saying, shouldn't we split them up? You know, cut the umbilical cord? Kasi parang, parang incestuous nga eh. Yung Secretary of Health is the chairman of the board of PhilHealth. PhilHealth is paying for claims for the expenses ng DOH, ng health-related. So parang, pwede ba yun? Pwede bang paghiwalay na yung dalawang yan at gawing independent talaga yung PhilHealth?
May mga ganong panukala, Sito. I think sa Senado ko yata narinig na baka maganda sana yata is ilipat na lang daw ang PhilHealth sa DOF. Pero ako personally, with all due respect sa mga may ganyang pananaw, ako, ang tingin ko tama pa rin na health secretary pa rin ang dapat umupo bilang hepe ng board ng PhilHealth. Because again, baka mawala sila doon sa ultimate goal of PhilHealth, which is really health of the Filipinos. Kasi kung ang nilagay po natin dyan ay very finance-driven, baka iniisip lang nila i-manage ang pera in terms of the finances, to keep the fund healthy, which is good. But then ultimately, aanhin mo yung pera kung namamatay naman tayong lahat, di ba? We have to make sure that those funds are translated into health outcomes. And tingin ko, yun ang dahilan kung bakit the health secretary sits as the head of the board. And ako, naniniwala ako na may ganun namang may wisdom doon.
Okay. Tama naman po, no? Because as I have to be faithful to what I said. I mean, if we want doctors to investigate the claims, it should only follow that the people heading the PhilHealth should primarily be doctors. Kaya lang kumisan at one point may congressman pa on the board of PhilHealth. Sabi ko, anong papel mo dyan? Sitaw ka na maingay. Anyway, Congresswoman, so last question ko na lang, ano po bang gagawin natin regarding the budget of PhilHealth? Kasi may mga nagsasabi, hindi, kanya ng problema yung PhilHealth, nagka-budget cut, etc., etc. Ano po ba ang mga balakin ng Congress in terms of the national budget?
Well, so ang proposed budget for PhilHealth premium subsidies, no? Kasi yun naman ang budget item ng PhilHealth is really to subsidize the premiums of our indigent kababayans, no? So yung mga mahirap natin na kababayan na hindi kayang magbayad ng sarili nilang premiums, yun ang sinasubsidize ng national government. And this year, ang proposed budget is 79 billion pesos, no? So ganun kalaki. Kami po, tingin ko, ang pinaka-importanting gawin ng Congress is really oversight. Kailangan talagang tutukan. Ito na nga, kung hindi natin tinututukan ang PhilHealth, hindi tayo nagtatanong ng mga kailangan tanongin, hindi tayo nagbibigay ng mga mungkahi, baka talagang walang mangyari. No? So as we know, in the last couple of months, di ba, ang isang dahilan din naman kung bakit parang tila sisikap naman ang PhilHealth to do a better job is because binabantayan ng Kongreso at ng Senado. So tingin ko, doon dapat ang maging mahalagang papel namin.
Okay, so kumbaga oversight lang. Walang we require you to report to us on a quarterly basis, etc. Kasi yes, go ahead.
Actually, may special provision na nasa loob ng 2021 2021 GAA. May special provision doon na kailangan mag-undertake ng actuarial study ang PhilHealth para once and for all, ito na nga, Yung katulad na nangyari last year, bakit nyo sinasabing malulugi kayo ng 86 billion and as it turns out, kumita pala kayo ng 30 billion. So yun ay function ng kung okay ba o hindi ang actuarial studies ninyo. So nilagay po natin yan as a condition na kailangan ninyo gawin yan. Number 2, kailangan din nilang gumawa ng management audit. No? So ibig sabihin, as we know, di ba last year, ang nangyari is nawalan sila ng about 16 yata na managers, na high-level officials. Either they got suspended or nag-early retirement.
Yung pinag-resign. Pinag-resign yung presidente.
Opo. So nawala po yung head nila, and then many of the top-level officials nawala. So ang inisip namin, baka magka-problema sa management. So ni-require po namin na mag-management audit. So kasama yon doon po sa GAA 2021. So babantayan din po natin. That's the subject of today's hearing.
Okay, last two na lang, mabilisan na lang, Kong, no? Yung sinabi mong yun, yung management audit, are you also going to require an audit of who and what these managers are? Kasi nabanggit mo na per region there are only 2 lawyers. We still have to determine if those studying the so-called fraudulent claims are actually doctors. Ang sunod na tanong ko, baka mamaya kung katulad yun sa board, sabi ko nga, pasensyaan na, magalit na yung kaibigan kong congressman. Sabi ko nga, anong ginagawa nito dyan sa kailangan dyan, mga doktor, mga scientists, etc. So, I mean, are you going to ask for an audit on the qualifications of people running the Philhealth?
Well, kasama yan sa any management audit, no? Kasama dyan yung tinatawag na pag-determine ng skills gap. So sa bawat job, titignan nila kung ano yung skills required at ima-match nila doon sa skills ng taong naka-occupy dun sa position na yon. Kasama po yun sa management audit. So yun yung hopefully marinig natin this afternoon. Itatanong ko po yan, Cito.
Thank you. And last but not the least, you were the one who once said, maybe we should consider having PhilHealth privatized. Do you still believe in that?
Absolutely. I have not backtracked from that philosophy. And just to clarify, no, hindi naman ibig sabihin ng privatizing PhilHealth is ibebenta natin ng PhilHealth. Hindi po. Ang sinasabi ko po is let's outsource certain functions from the private sector. And it can be broad. Halimbawa, legal services nga. Kung ang lumalabas, baka mas mabuti pang mag-hire na lang ng mga private law firms para sila pong mag-prosecute or to keep retainers na mula sa private sector. Why not, diba? Or pagdating naman sa IT, kung yung expertise ay nandun sa private sector, why don't we outsource the chief information officer? Or at the extreme, kung gusto nyo yung management team mismo, yung mismong execom, why not, right? Yun ang sinasabi ko, na maging bukas tayo na hanapin natin kung saan sa buong bansa ang expertise. Kasi hindi madali eh. It's complicated ang health insurance. Hindi basta-basta na kakayanin gawin ng kahit sinong tao. Meron talagang skills required. And dahil pera yan ang manggagawa, lahat tayo nagko-contribute para sa PhilHealth Fund. We own it actually. We want to make sure that it's run in the best possible way. So let's get the best talent in the entire country.
Okay, push niyo po yan, yung mga privatizing certain aspects or units of PhilHealth, susuportahan ka. Thank you very much, Congresswoman. May God bless you. Please stay safe, stay strong. Wag kang magpapahawa, ma'am.
Kayo din po.
Okay.
Thank you very much.
Thank you very much. Yan po si Congresswoman Stella Quimbo, and alam nyo, malaking bagay po na nasa Kongreso yung ali na yan kasi number one, she is very qualified. She has so much learning experience in the University of the Philippines, and also kasi talagang she's on the ball. Alam niya talaga, she knows what to pick on and what to get off the table. So, yun. Now, let's move to our next guest. Let's move to the city of Cebu, because in Cebu, it seems that the current concern that's in media are the number of pediatric cases, COVID cases, or children getting COVID. Let's speak with Acting Mayor Michael Rama of Cebu City. Acting Mayor, good morning sa imo. Oh, nakamute.
Hello, Cito.
Hello, good morning.
I am back as the Vice Mayor, although
Ah.
my Mayor has not uh, presented himself yet in the public. So I'm still working hard for our COVID and so with the pandemic.
Okay, what happened to
Vaccination as
the
well, vaccination.
what happened to the mayor Vice?
He has a medical problem. I do
Aha,
not
okay.
want to be a spokesperson on that matter.
Okay. No, just to be polite because people might be wondering what happened to baka kasi alam nyo, usong-uso na ngayon. Ngayon, ang trend is that government officials are getting infected with COVID-19. Anyway, Vice Mayor Rama, if you would, could you please update us on what's happening in Cebu because once again, you are in the headlines, Cebu City, because of children, pediatric cases, lalo na doon sa mga shelters who have been getting COVID-19. So, what is the situation there?
As of now, we are pretty well containing from the point of view of the LGU. Number two, in addressing the TTMF, which is the Temporary Treatment Monitoring Facility. In fact, likewise, the LGU advancing money and even lending nurses and make DOH hire to address the medical staff concern. Number five, with respect also to dead bodies, which is also a concern, the church under Archbishop Jose Palma been entering into an agreement, and we are definitely not going to be troubled much because we will be also having an available space. And then, of course, we're talking about the issue about pediatrics. That's a matter also that DOH been cognizant about, and our EOC. I think you have heard about Emergency Operation Center, and that still being headed by retired General Mel Feliciano and a counselor attending to it as well. So in effect, Cito, we are really doing all our best. And when I was the acting mayor, and still until August 31, we we are being placed under MECQ. And we had an opportunity. I issued an executive order 137, it being known as Uplan Puyo. Ibig sabihin, Uplan, matigil ka muna sa bahay. Yun ang ginawa natin. At saka mayroong famous na IMSAHO. What is IMSAHO? Mandatory stay at home order. So unless it is essential, you must stay at home. And most of all, our governor, Governor Gwen Garcia, is also leading the whole island in order to address this concern from the province side and the Tri-City as well.
Okay, Vice Mayor, I know that Lawag and another town in Davao Oriental, if I'm not mistaken, have implemented a no movement day. Yan bang insaho nimo? Yan ba ay stay at home or no movement day din ba yan? Or is it just every day no movement except for essentials? And do you guys require to have passes?
No, we don't engage anymore in the so-called quarantine passes. We empowered, Sito, we empowered. I even introduced before we were under MECQ, ginawa ko, kasi acting mayor ako, it was being suggested right away. I did my first executive order, yung curfew, at saka yung sinasabi nating liquor ban. Then thereafter, there was already the so-called placing Cebu City under MECQ. Then as early as August 15, we indeed have with that MSAO. And that is until the end of the month, Zito, we are glad that our regional director, Ronnie Montejo, had provided us 500 men in uniform. Saka bottoms up yung setup namin dito, Sito. It's not from City Hall. It is down there at the parental area, which I even called it parental supervised household lockdown. Talagang mag-umpisa doon. Saka papunta doon sa chapel, papunta sa church, hanggang aabot ng the whole entire barangay. And we introduce the intra-barangay quarantine, protocol quarantine points. Parang nag-check. And we have a requirement. And I am very proud, jointly with the Mayor Edgardo Colina Labella, that our men in uniform at saka yung mga multiplier forces, they are pretty well doing their job. And we also apologize to some stakeholders who may be affected. But definitely, this is what we call it a bitter pill than getting to contain with unimaginable rise. Pretty well by now, if you wish to know, as of August 24, do I have the chance to present to you just quickly, Sito, the figures?
Hello?
Yes, Sito, can I
Yeah.
present the figures?
Quickly lang, sir, kasi...
Yeah, okay, no problem, no problem.
Okay.
We used to have about 5 days ago, we used to have 300. Then it went to 400. Then it went to 300. Now we already have 263. That is something that we are pretty, in a way, optimistic. If we continue yung sinasabing mandatory stay at home, then I would see by the end of the month, we will definitely will have some breakthrough.
Okay. If at what level will you go from MECQ to MGCQ? At what level or number of infections or cases?
Actually, it will always be IETF national who would have the data. We've always been told whatever is going to happen to an LGU, it's not the IETF doing it. It is the data that is being provided by our DOH to IETF. And the data, according to them, will never lie. Only liars cannot figure. Therefore, that is very important. So we will be doing everything we can, Sito. Wishing that we should never be under ECQ, but we should be given certain breathing space. And perhaps that is what you wished also probably to happen to Cebu City.
What about this thing about door-to-door vaccination? Are you actually doing door-to-door vaccination?
You know, Sito, when I came in, the vaccination side is the mayor, and I only call myself the convener head. And we have conceived 21 vaccination site, hybrid yan, Sito, hybrid, which had included yung sinasabing bakuna sa tugkaran. Itong bakuna sa tugkaran, this is regarding yung mga hindi na ambulatory, bedridden, at saka mobility are very much restricted. Then there is EROF, the Emergency Rescue Unit Foundation. And this is headed by Dr. Peking Lim. And the one doing with the staff of EROF is Dr. Peter Mancao. Yan, pumupunta kami with the connectivity being provided, with the guidelines also set, Then, yung Aero, Dr. Peter Mangkaw, at saka yung group being expanded, pumunta sila doon mismo sa bahay ng may bedridden na possible na i-inject namin.
Okay. Okay, so at least it is clear the numbers are going down. In spite of numbers going down slightly, you are still enforcing itong mandatory stay-at-home order. And then, what about transients coming in from other provinces? Kasi like in Masbate, governor ko apparently issued an order, no vaccination, no entry. What about Cebu City?
That is already what we have in place. Actually, it's not even the vaccination. We're talking about RT-PCR. Yung inbound, talagang we've been very strict, and that is being taken care of by our Emergency Operations Center, now with the Deputy Chief Implementer, Councilor Joel Gargadera. We are very strict in that particular aspect, Cito, but on the issue of no vaccination, we are not yet including such a requirement. It's more on the RT-PCR and even the antigen.
Do you have enough vaccines available to Cebu, and how soon before you get the so-called herd immunity?
Actually, we are looking forward if vaccines will be in storm kasi yung we conceived the vaccination, I called it Cebu COVID vaccination saka SRP, Storm Rollout Program. Kaya sinasabi ko yan, CB, Central Visayas, South Road Property. But actually, it meant Cebu Vaccination Storm Out Program. Now, with all this that is being assured, because I'm in contact with Secretary Galvez, Carlito, so I've been in a Zoom with Secretary Vince Dizon. And pretty well, they are already sending us, and if it will continue to be increasing, Cito, we can assure you with the 21 hybrid, kasi yung 21 hybrid will include drive-thru. Yung 21 hybrid vaccination program namin, aside from yung tugkaran, yung sa bahay mismo, mayroon ding vaccination that will be very near to your home, and that will be more or less within the strategic area within Cebu City. Number
Okay, so we're running out of time, Vice. Pero around
Yun.
what month do you think
month
you will have?
December. And then saka ngayon, we have already have in our master list already almost over, we're getting to be into 650,000, and we've gone far 40% on our first dose, 26% on our second dose. And the vaccines we have right now, which is going to be consumed in due time, is Sinovac and Moderna.
Okay.
We have all these vaccines, Cito. You can come to Cebu by January.
All right.
A
Well,
standing invitation for Sinulog. Be around to enjoy the jubilation.
okay. Thank you very much, Vice Mayor, for that very optimistic invitation. Ipagtabi mo na ako ng lechon belly. Thank you very much.
Yes,
God
yes.
bless
I
you.
will be your tourist guide, guaranteed.
Okay. Thank you very much, Vice Mayor Mike Rama, and okay na invitation niya, no? That's the kind of invitation I like. Lechon bellies from Cebu. Okay. Now we'll go for a quick gap. When we return, balik Metro Manila tayo. We will welcome back Mayor Joric Gacula of Taytay Rizal here on Agenda. Okay, we're back here on Agenda. You are watching us via Cignal TV channels 8 and 250 and through the services of PLDT. You can also watch us on facebook.com/OneNewsPH and on YouTube, OneNewsPH. Okay, let's bring in Mayor Joric Gacula of Taytay, Rizal. Mayor, welcome back.
Good morning, Cito. Magandang umaga po sa inyo.
Okay, kamusta naman? How are things in Taytay? Kasi kailangan kong kamustahin dahil yung aking misis ay gigil na gigil lang makapunta dyan sa mga telahan. Taytay is so popular for its fabric market. It is the primary source for all people who love to sew, who need clothing. Pero other than your Taytay tela markets, kamusta naman po?
Well, yun nga, we are now under MECQ since August 5 ng hating gabi at alarmingly ay para din kaming Metro Manila. Our COVID cases rose by almost 80%. No? During the first week of August, we only had 70 cases. But as of yesterday, we had 350 active cases of COVID-19. And ayun nga, the business, the economy is still running. And ayun nga, we're just trying to impose stricter measures para po sa mga dumadalaw dito sa amin para mamili sa aming garments and textile sector.
Okay, now, as far as those cases are concerned, do you have a profile of who is getting infected? Because it seems that things are shifting. Last year, it was all about senior citizens and people with comorbidities. But now, it seems to be about anyone from 6 months to 10 years old or 15 years old. Parang puro bata ang tinatamaan in other places. What about in Taytay Rizal?
Well, dito sa amin sa Taytay, since we have a border with Taguig City and Pasig City, and most of the residents here are working in Metro Manila, ang tinatamaan sa amin kadalasan ngayon ay yun nga, yung mga people who work in call centers, yung mga people who working in Metro Manila, yung mga yung mga ages from 20 years old to 45. Medyo tumaas yung sector na yan. Dahil nga sila yung everyday nagko-commute, nagtatrabaho sa Metro Manila na exposed sa COVID-19 infection.
Okay, what about in terms of vaccination? Kasi the government rolled out vaccination for A4s, yung mga nagtatrabaho. Diyan ba sa Rizal, hindi ba sila nabakunahan?
Well, ito nga, alam mo Sito, when your secretary called me up, I was excited because I can bring this matter to the media. Ever since pumasok yung vaccine, we were all the Mayor's League of Rizal, headed by Mayor Cesar Inares, has always appealed to the DOH to consider the first district of Rizal and also San Mateo and Montalban, since we have a boundary with Quezon City and on the San Mateo Montalban side, and we have a boundary with Pasig City and Taguig in Taytay and also in Cainta. Most of the people residing in the first district of Rizal work in Metro Manila. That's why we are the second most populated municipality in the whole Philippines, Taytay, no? And Montalban is the first, and the third is Cainta. So we were always asking them to consider the first district of Rizal and the two towns in the second district to be part of Metro Manila. Do you know that, Cito, we haven't been getting a fair share of the vaccines? Sa Metro Manila, there are some cities na they already achieved their target, and they're already welcoming walk-ins, no? Here in our town, mababa pa ang supply, although we have taken this matter to Secretary Duque through the courtesy of Sec Alfonso Cusi, who is the big brother of the administration to take care of the pandemic here in Rizal. No, we have we have been requesting always, and fortunately there were additional vaccines, but not like the supply of Metro
At
Manila, not like the supply of the other Metro Manila towns na talagang very abundant ang supply. No? Dito sa amin, there are days that we don't have vaccines, and we still wait for the supply of the DOH. That's why until now, although there had been additional supplies, but we still need more because I've been stating that Taytay, Cainta, Montalban, and San Mateo, Binangonan, and Angono are like Metro Manila towns already. We are the suburbs, and we are the no, we are the people who work in Metro Manila reside here in our municipalities.
okay, ano ba yung population ng Taytay, Mayor?
Well, as of 2017, we have a population of 375,000. So
300.
by now I think that's more than 400,000 na yung sa Taytay.
Okay, so let's just assume that you have 400,000 and your only fully vaccinated people is 15,600. Your partially vaccinated is 29. You are somewhere at 45,000. So parang kung sasabihin na lang natin single dose, 10% lang kayo. Kung double dose, medyo wala. Hindi pa kayo naka 10%. Now, what is the situation health facilities in Taytay?
Well, kami po ay kompleto na, no. Even before, we boasted of hosting the biggest freezer warehouse here in the side of Metro Manila, and we can accommodate 25 million doses of whatever vaccine. For example, Pfizer, kaya namin mag-accommodate sa aming warehouse, no, yung refrigerated warehouse. And since we are first-class municipality, the first district of Rizal has acquired the state-of-the-art freezers that can go up to -86. And besides that, our Congressman Duavit, supplied the municipalities with a freezer also capable of accommodating every kind of vaccine available now. So pagdating po sa facilities, we have 7 COVAX vaccination facilities including SM Taytay, and we are very ready. Talagang sabi nga, nandyan na ang freezer, Pfizer na lang ang kulang.
Baka naman mali ang nabigay sa inyo ni Congressman Duabit. Baka kailangan kumuha kayo ng mga 6x6 trucks tapos dalihin nyo lahat yung mga tiga-Taytay sa loob ng Metro Manila para doon magpabakuna. I mean, this is really insane when cities in Metro Manila are already sharing their vaccines with other cities while you guys in Taytay, Binangonan, San Mateo, nakaalabas ang kamay, yung freezer walang laman. Don't worry, Mayor. We will take this up in our column, and of course, we will keep mentioning this disparity and disadvantage that you, the suburbs of Metro Manila, are experiencing. Maraming salamat po, Mayor.
Thank you, Cito. Maraming salamat sa pagkakataon na binigay mo to air our side and our grievance also.
At saka yung tumawag po sa inyo ay yung aming guest coordinator. Hindi ko po sekretaryo. Baka masampal ako mamaya. Okay, thank you very much.
Napakabait po niya. Thank you po.
Thank you very much, Mayor Joric Gacula. Okay, and that's all the time we have. And ayun po, no? Sa mayor na nanggaling, may freezer na sila. Even for the Pfizer vaccine, which is negative something, wala naman daw silang makuhang wala silang makuhang bakuna or not enough. Okay? Mabuti pa yung beer, nasa sub-zero. Pero yung Taytay, pagdating sa bakuna, 0. ang kanilang mga freezer. I'm Cito Beltran, thanking you for joining us this morning, and hello to Levi Lopez and Alan Blackman for your comments. Have a good day. Take care. God bless you all.